Welcome everyone. Thank you so much for joining us today. My name is Jennifer Farmer and I have the privilege of serving as the Program Director for the iTP3 project. Today's webinar concludes our month-long Innovator Showcase event in which we have focused on highlighting innovative teen pregnancy prevention programs every Tuesday in May. Before we dive into content, I want to acknowledge that this opportunity is made possible by a grant from the Office of Adolescent Health. Contents within this webinar are solely the responsibility of Texas A&M University and do not necessarily represent the official views of the Department of Health and Human Services or the Office of Adolescent Health. And with that, let's go ahead and get started. During this webinar, we're going to introduce you to the iTP3 project team and current iTP3 innovators, tell you a little bit about our project, and briefly review currently funded innovative projects. Now it's time to meet the iTP3 team. Doctors Kelly Wilson and Whitney Garney serve as co-principal investigators. I, Jennifer Farmer, serve as Program Director, and Kristen Garcia serves as our Evaluation Director. In addition, we have 4 team members who serve as project liaisons, including Christy Esquivel, Jordan Nealon, Danica Mora-Lethran, and Caitlin Holden. As project liaisons, they have worked closely with iTP3 innovators and serve as the primary point of contact on behalf of iTP3 project. Now I want to share with you a little bit about who we are and how we got started. In July of 2015, the iTP3 team began an exciting journey to support and enable innovation in teen pregnancy prevention. This opportunity was made possible through a cooperative agreement from the Office of Adolescent Health. As just one of 2 Tier 2A grantees, we were tasked with identifying and assisting innovators across the nation to develop innovative program-based approaches to teen pregnancy prevention. Over the past 3 years, our team at Texas A&M University has worked with a variety of organizations, partners, and leaders, both within and outside of our field, to push the boundaries of prevention. iTP3 represents a unique opportunity to expand the current base of teen pregnancy prevention programs. As such, we have purposefully sought and funded programs that go beyond the traditional approach to prevention. iTP3 funded programs are helping to create a shift in prevention by broadening the focus from individual level change to changing systems. In total, iTP3 has supported 20 innovators since the start of this project. All innovators were selected through an annual competitive application process. And between the 3 application periods, we received a total of 141 applications. This is a clear indication of our field's recognition of the need and importance of innovation. Now it's time to meet our 20 innovators. Rather than reading each of these names, I'm going to give you a minute to just browse through the list. As you can tell, there's a lot of diversity in the type of organizations we have worked with. These organizations range from large hospitals and nationally recognized organizations to small nonprofits and even a local health department. You'll notice when looking at the list that some of these innovators are in gray text, while others are in white text. The gray text represents innovators previously funded by our project, but not currently receiving iTP3 funding. Innovators have been funded on an annual basis and have had an option to reapply for additional funding. We successfully selected 15 organizations from across the country to be part of our first innovator cohort. Of this 15, 6 received an additional year of funding to continue their program development activities through June 30th, 2018. In addition to these 6, iTP3 funded 2 new projects. Both of these projects began in June of 2017. Today, we're going to introduce you to these 8 innovators. In case you're interested in learning more about Cohort 1 projects, you can read more about each of them on our website. Lastly, I wanted to mention in December 2017, we awarded 3 additional innovators with accelerator funding to support their program development activities for 6 months. Unlike our traditional application process, these innovators were selected through a design thinking training facilitated by the iTP3 team, during which organizational teams developed prototypes for teen pregnancy prevention programs. Before jumping into the overview of each program, I wanted to share with you a few big picture descriptions to highlight the diversity of iTP3 funded projects. First is target populations. Innovative programs developed by iTP3 innovators have targeted foster care youth, LGBTQ youth, youth with intellectual and developmental disabilities, depressed young women, homeless and runaway youth, college students, family units with adolescents, parenting teens, victims of intimate violence, older teens, as well as racial and ethnic minority teens. In addition, these programs have been designed for a variety of settings, including clinic-based, faith-based, in-school, higher education, out-of-home care, outdoors, and community-based settings. Despite the variety of programs funded through the iTP3 project, our team has worked closely with all innovators to provide support related to a variety of areas, including design thinking, systems thinking, evaluation, program development, and dissemination. This tailored capacity building assistance has served to support program development activities and enhance the likelihood for future programmatic impact. In fact, the pictures that are included for each innovator in the upcoming slides are from an in-person design thinking training during which team members came together to learn how to apply design thinking to the development of their program. Before introducing you to each of the Cohort 2 projects, there are a few additional things I would like to point out. As a reminder, 6 of these projects have been funded since May of 2016, and 2 have been funded since July of 2017. Each project is unique, and program development activities vary significantly between projects. Innovators are not expected to complete the development of their proposed program within 1 year, and as such, all programs are still under development. While many programs will be ready for pilot testing by the end of this year, you will notice that some do not have an official program name. Rather, their name currently reflects their overall project. Something else to pay attention to in the overview of programs is how they differ from traditional evidence-based teen pregnancy prevention programs. Consider their target populations, implementation setting, and approaches to prevention. Lastly, I want to emphasize that each of these programs have been directly informed by the populations they are intended to serve and impact. Innovators have spent a significant amount of time designing their programs to align with the user needs and interests. This is definitely one aspect of the iTP3 supported innovations that make this opportunity so unique and promising for the future. The first innovation team I would like to introduce you to is Boston Children's Hospital. Led by Dr. Lydia Schreier, Boston has been an iTP3 innovator since May 2016. Boston was funded to develop MARCI, short for Momentary Affect Regulation, Safer Sex Intervention. MARCI targets young women with depression. It starts with brief motivational interviewing, clinic-based sexual risk reduction counseling, and cognitive behavioral skills teaching, followed by daily mobile self-monitoring. When depressed young women report depressing feelings and maladaptive thoughts, they will receive messages that prompt the use of cognitive behavioral strategies that challenge depressogenic thinking, promote affect regulation, and encourage enjoyable behaviors in the natural life context in which negative thoughts and unhealthy behaviors occur. MARCI capitalizes on the advantages of in-person counseling while keeping this more resource-intensive component brief. The intervention is innovative, practical, and scalable, and using mobile technology to apply real-time self-monitoring and context-responsive intervention in daily life. While MARCI started from the very early stages of program development, the Boston team has progressed significantly. During year 1, they conducted iterative interviews to inform the intervention, developed an intervention manual, and started feasibility testing. During year 2, in addition to continuing feasibility testing, they conducted interviews with staff from a variety of clinics that serve depressed young women. The purpose of the year 2 interviews is to identify system-level interventions to improve the care of young women with depression and high-risk sexual behaviors, as well as create recommendations for MARCI implementation in different clinical settings. In the future, Boston plans to conduct rigorous evaluation of MARCI in hopes that it can be implemented on a larger scale. The Children's Hospital of Philadelphia, often referred to by our team as CHOP, has been funded by the iTP3 project since May of 2016 to develop their adolescent center model of contraceptive care. Through the leadership of Dr. Aletha Akers, CHOP's program has focused on making teen pregnancy prevention an integral part of pediatric primary and specialty care. To do this, CHOP has concentrated on integrating several complementary strategies known to improve contraceptive uptake and adherence into a single care model. Their overall program includes working with parents via a web-based peer advisor program, working with medical providers via an initial reproductive health visit, and working with adolescents via contraceptive health coaching. With this three-pronged solution, they hope to improve the delivery of adolescent reproductive health services in a pediatric hospital setting. As a result, parents and caregivers will gain the support they need. Providers can discuss reproductive health with their teen patients, and teens will have the knowledge and support they need to use birth control effectively to prevent pregnancy. CHOP has worked closely with teens, parents, and medical professionals to develop their program, and they plan for their model to be scalable to other clinical settings in the future. While still under development, they are currently planning to create trainings to assist with future implementation of their program in other settings, a guide for health coaching, and a resource guide for youth. ETR has been funded by the iTP3 project since May of 2016 to develop a program for young African American males. Through the leadership of Karen Coyle and Pam Anderson, ETR has partnered with Omega Phi Psi, the first predominantly African American fraternity to be founded at a historically Black university, to develop a program focused on fostering healthy romantic relationships. Through direct guidance from young African American males, fraternity members, parents, and community advisory board, ETR has worked with the Sigma Iota chapter of the fraternity to develop a module with several healthy relationship-related lessons. The content within each lesson responds to what the young African American males identified as content of interest and importance during several focus group sessions. The module will be incorporated into an ongoing and existing mentoring program facilitated by the Sigma Iota chapter, allowing pregnancy prevention to be woven into structured mentoring to address sexual health in tangent with other important social determinants, such as academic success and connectedness to school and caring adults. Due to the Omega Psi Phi structure, this program has the potential to be implemented on a national scale and possibly even an international scale in the future. The Georgia Campaign for Adolescent Power and Potential, often referred to by our team as GCAP, has been funded by the iTP3 project since July of 2017 to begin development of the Pipeline Project. Led by Dr. Shelley Francis, GCAP's program focuses on building the skills and confidence of pre-service health and PE teachers during their first few years of their teaching career. GCAP has partnered with Kennesaw State University, the largest teacher preparation program in Georgia, to alter the paradigm of sexuality education training by creating a rigorous teacher training program using the National Teacher Preparation Standards for Sex Education. In addition, GCAP has also partnered with the Future of Sexuality Education, better known as FOSSE, to provide technical assistance and training to ensure successful integration of the National Teacher Preparation Standards for Sexuality Education and clear understanding of the National Sexuality Education Standards. Few professional development opportunities currently exist for teachers to learn how to effectively facilitate content and advocate for evidence-informed sexual health education. Through this program, pre-service teachers entering the pipeline will receive specialized training while earning their degree, as well as individualized coaching and access to a network of veteran sexual health education teachers once they have a classroom of their own. The Pipeline Project will also provide training on strategies and tools for advocating or initiating local school-based sexual health programs and policies. During their first project year, GCAP has used design thinking to collaboratively generate prototypes for the Pipeline Project. They have successfully worked with stakeholders and the program's target populations, including KSU faculty, teachers from various Georgia school districts, pre-service teachers, and students. Mississippi First. The next ITP3 innovator I would like to introduce you to is Mississippi First. Led by Josh McCauley, Mississippi First has been funded by the ITP3 project since July of 2017 to begin development of Linked Up. Linked Up is a program that focuses on linking older teens ages 17 to 19 to youth-friendly sexual and reproductive health services as they transition from high school to college, or whatever their next step might be, and into the adult healthcare system. Linked Up focuses on linking and educating youth about sexual and reproductive health care post-high school graduation, contraceptives, and health centers throughout Mississippi. Students will be able to carry the knowledge of this program with them into adulthood and be able to make safe choices because their sexual and reproductive health care was uninterrupted after graduating from high school. In addition, Linked Up aims to improve the procedures, protocols, and policies at high school-based health centers and at the state's public universities and community college. This program specifically takes advantage of an existing law in Mississippi, Senate Bill 2563, passed in 2014, which requires that each public university and community college in the state take action by developing a plan to address unplanned pregnancy prevention among their students. Mississippi First has spent the first program development year working with Jackson and Mississippi Delta high schools with a school-based health clinic to inform the development of Linked Up. This includes working with high school students, district and school administrators, as well as school-based health center providers. In addition, they have partnered with the Women's Foundation of Mississippi, who works closely with local community colleges, as well as the University of Mississippi's Medical Center School of Nursing, which is responsible for running the school-based health centers at the partnering high schools. While still in the early stages of program development, Mississippi First plans for Linked Up to be scaled to at least the Jackson and Mississippi Delta level and hope it will be used as a model for school-based health clinics across the state. The Multnomah County Health Department in Portland, Oregon, has been funded since May of 2016 to develop the Sexual Health Equity for Individuals with Intellectual and Developmental Disabilities program, also known as SHEED. Led by April Kaiser, the SHEED project team is working to grow community connection, coordination, and support so that all young people experiencing an intellectual or developmental disability have access to holistic sexual health education and support. The SHEED project is specifically focused on providing tools, resources, and training to support families, peers, teachers, IDD service providers, and healthcare providers. SHEED was directly informed through a comprehensive needs assessment. This consisted of surveys and focus groups with youth experiencing IDD, their caregivers, teachers, and other service providers. In addition, the assessment also included a review of existing state and service provider policies and procedures related to sexual health services for youth with IDD. Through the design process, Multnomah has learned from youth with IDD that they desire to learn about identity, sexual and reproductive rights, communication, healthy relationships, and they want to teach and learn from people their age. They also learn that while there is a state policy acknowledging that youth with IDD experience sexual health disparities, that comprehensive sexual health education is known to mitigate, there is no guidance, resources, or support to implement holistic sexual health education with this population. By strategically addressing the gamut of curricula, trainings, policies, and procedures geared towards these individuals, organizations, and systems that serve and impact this population, SHEED builds an integrated web of support to advocate the sexual and reproductive health of all youth, and particularly those marginalized by current practices. Led by Dr. Lisa Colarosi, Planned Parenthood of New York City has been funded since May of 2016 to develop their program, Capacity Building for Foster Care Organizations, referred to as CB4FC. CB4FC is a multi-level approach to training foster care professionals, creating organizational policies and practices, and enhancing the physical environment of foster care agencies with materials and messages directed toward teen pregnancy prevention and sexual and reproductive health overall. CB4FC is structured so that evidence-based programs for sexuality education of youth and foster parents can accompany the program. This model does not train professionals to conduct evidence-based programs. Rather, its innovation stems from teaching them to create a sustainable environment where youth can talk to trusted adults who have medically accurate sexual and reproductive health information and supportive communication skills. Combined with policy and materials, this can facilitate sustainable access to healthcare and evidence-based programming. During the course of program development, PPNYC successfully partnered with the New York City Administration for Children and Families and 6 nonprofit foster care agencies. They collected data to inform program development through focus groups and individual interviews with foster parents, a variety of foster care professionals, and foster care youth. By the end of this project year, they will have a manualized model of organizational capacity building with acceptability and feasibility data. PPNYC hopes organizations working on teen pregnancy prevention can use this model with foster care agencies in their own communities to improve sexual and reproductive health outcomes for foster care youth. In the future, they plan to rigorously test outcomes and develop electronic technology to support key components of the intervention. Through the leadership of Kent Anderson, WAIKIKI Health has been supported by the iTP3 project since May of 2016 to develop WAHINE Talk. WAHINE Talk is an innovative teen pregnancy prevention program designed for homeless and at-risk girls between the ages of 14 to 19. This program emphasizes social connectedness and creates opportunities for youth to build healthy support networks with peers, social service staff, and medical providers. Through WAIKIKI Health's Youth Outreach Program, a street outreach and drop-in center for homeless and at-risk youth, WAHINE Talk offers basic life needs such as food, showers, clothing, as well as transportation services. In addition, the program facilitates educational opportunities to increase participants' sexual health knowledge and provides participants with access to highly effective methods to prevent pregnancy through an on-site medical clinic and partner clinics. Peer mentoring is another significant component of the overall program. The peer mentor is someone youth can easily accept as a partner in their pregnancy prevention goals, and they can help to enhance social connectedness through social media, texting, phone calls, and in-person counseling. WAHINE Talk also uses a technology-based incentive program to engage participants. Each participant receives a smartphone and data plan based on a tiered incentive model, allowing the program's peer mentor to communicate with participants and providing participants with 24/7 support through calls and texts. Homeless and at-risk youth have been directly involved in the development of WAHINE Talk. By the end of this project year, WAIKIKI Health plans to develop a program manual that includes concepts, processes, and procedures for internal training and potential replication. After further testing, they hope this model can be replicated by youth drop-in centers across the country. And that concludes our webinar. If you're interested in learning more about the iTP3 project, I encourage you to check out our website and follow us on Facebook and Twitter. Thank you so much for joining us again today.